strong people do not get depressed. This is the line I hear all the time, which is not the truth.
I agree that anxiety before an event will be very natural to happen, but why do you think that loneliness creeps in at night?
While we get alone at night, we go to sleep, the mind is very, very calm at that time, and it usually
As doctors, we often see young patients. Some have chest pain, just random leg pains. Some doctors end up labeling it as pure anxiety. Some would label it as panic attack. What exactly is the difference between anxiety and panic attack?
patients come to us saying that they feel that they're going to die. It's a heart attack. So they're sitting somewhere normally sipping a coffee, and suddenly they will have a blast of panic.
I've heard the word burnout coming up very frequently these days.
People feel meditation is the cure for every mental health disorder. Meditation can trigger your anxiety at a lot of times to get away from a lot of mental health crisis. Sleep gives you a lot of recovery, be it physical or mental. And here I would like to talk about rapid eye movement sleep.
Practical steps would you recommend to reset their cortisol levels
So first of all, stop caffeine intake after 2 p.m.
after 2 p.m.?
Yes.
We've taken some of the most frequently Googled mental health questions and put them directly to our guest today, Dr. Shachi Patel, a clinical consultant, psychotherapist, and psychologist, who will share her views, opinions on all these mental health issues in today's podcast. She works at the Mind Clinic Vadodara and is really very great at her work, and her inputs shall be very helpful to all of you. So, welcome to the podcast, Shachi.
Thank you so much, Dr. Sumit.
So, Shachi, starting with a question that appeals to a lot of our people, especially in relatively smaller city like Vadodara. What are the biggest mental health and wellness challenges that you would have observed?
The biggest mental health and wellness challenge which I has observed is lack of preventive care. People only go to doctors when it's in the end moment, when everything has gotten worse. So they don't believe that preventive care जैसी कोई चीज है. And with the increasing fast life we have, the sedentary lifestyle we have, people don't believe in workouts, people don't believe in good diets. Right now fast food is emerging like anything, and people don't believe in local food and taking care of their health this way as well. So they usually come to me at least at a time where everything has got worse. They have started with a metabolic disorder, or females have gotten in with PCOS and has affected their mental health, because they don't understand that it is completely correlated with each other. They come to me at the end.
As a city, because with tier 2 and 3 cities also being densely populated, but I guess there's a difference in the mindset as compared to metro cities. So what difference do you see because you worked in different places as well? So what mindset difference do you notice between people who belong to tier 2, 3 cities versus the metros?
So basically, when I worked in Bombay and now when I work in Vadodara, which is a very classical difference between tier 1 and tier 3, I've seen that people don't talk about mental health here very openly. While in tier 1, people have started accepting that mental health really matters and it can affect you in ways you don't know. But when it comes to smaller cities, people still feel that it's a taboo to talk about, it's a stigma to talk about. So usually they feel that a stronger man or a stronger woman won't be affected with mental health, or maybe if they're going through crises, eating well, eating zyada khana in portions, ghar ka khana is going to sort everything out for them. So there's a classical difference I have seen between two cities.
I would agree to that also. And that mindset difference we see is also there when it comes to treatment problems. When treatment of medical problems, there is a mindset difference between metros where they want to get it done faster and get over with it and move to their busy life. Whereas maybe there's a little laid back thing here.
Yes, correct. Yeah.
Talking of mental health, which is a common but not so widely talked about issue. So what are the few things that you wish that people would really unlearn when it comes to mental health?
So, the very foremost thing I would like to talk about is that strong people do not get depressed. This is the line I hear all the time, which is not the truth. Anyone and everyone can be affected by mental health crisis. Second is that people come to us by saying that हमने घर पे बहुत सारी remedies करी, WhatsApp statuses पढ़े, we found remedies on YouTube, but now because we are not feeling better, we have come to you, and there is no preventive care because they usually sort of see a lot of Instagram and YouTube reels where a lot of influencers are talking about mental health. Unverified information is also the problem adding to this myths. So the third is that people feel meditation is the cure for every mental health disorder, and that really leads people into trouble because meditation can trigger your anxiety at a lot of times. And the fourth is family doctors, where people rely on them very largely, that कोई भी problem है तो we can go to family doctors and sort it out, which is really not the case.
I would agree to that people find shortcuts for whatever they have, so they'll find their way around. But at the end, they may feel that there is a need for a specialist, and that's where you come in. Coming to the first part of our discussion today is about anxiety, a very common problem, and we've heard it so frequently. People getting anxious, be it a podcast like this, a stage performance, or even work. And sometimes anxiety has no triggers. So would you really say about why is anxiety so common these days, and what can someone really do about it?
So I would say that actually anxiety can come from a lot of stress. While we go deeper into stress, there are two type of stress. One is good and one is bad. So usually when we talk about something which is a stage performance or a podcast like this, little bit of anxiety is common and it is normal to have it. So your amygdala is trying to process the whole scenario of what is happening, while the other time the anxiety is very deep rooted and it has completely blown out of proportion because the lifestyle is very fast. People are not sleeping on time, people are not working out, there is no movement, and this is why the anxiety has kicked in. While when we talk about stigma, there are a lot of people who have not been opening up with anybody, thinking that they will be judged, they will be thought of as a wrong person, and this is where the mental health crisis piles up. And sometimes the most common thing we see in these people is anxiety.
I agree that anxiety before an event will be very natural to happen, but an extension of anxiety is feeling lonely, and that especially bothers so many people at night. So, as a mental health specialist, why do you think that loneliness creeps in at night?
So basically, what happens is the whole day goes by very busy. We have work, we have people to talk to, we have events to attend. So the mind surpasses that signal that something is happening. While we get alone at night, we go to sleep, the mind is very, very calm at that time. And it usually pinpoints all the problems which we have surpassed for the whole day at that time. So this is the exact period where we are trying to sleep, where we are trying to calm down. All the worries which we have put it under the rug are going to come back again, and this is the exact reason why we feel more anxious at night.
To add to that, seeing others' stories on Insta would add to that.
Correct. Yes, absolutely. Everyone has nighttime scrolling. 9 baje ke baad everyone is on Instagram, and we usually dwell upon things which we don't achieve. So when we see others' success, we also feel that yaar humne ye nahi kiya hai. We have not been able to do things. So this also raises your cortisol in the term of stress. So when you see blue screen at night, your cortisol is going to go up. Usually this is the time when you have to wind down. The cortisol has to go down, but the brain doesn't understand that and triggers anxiety because cortisol gets confused that what is to be done now, is it a day or a night, and this is the reason we feel more anxious at night.
No scrolling at night, not even this podcast. As doctors, we often see young patients, who have a lot of symptoms. Some have chest pain, just random leg pains, and we do not find a real physical cause behind it. Some doctors end up labeling it as pure anxiety, some would label it as panic attack. So, I want to understand from you what exactly is the difference between anxiety and panic attack.
So, first of all, whenever a mental health symptom comes on a physical plane, we usually call it as psychosomatic disorders, where all the mental issues have started reflecting on the physical plane because you're not able to process it. While anxiety and panic has been used as jargons nowadays, everyone is talking about it, but they are very different terms when it comes to sign and symptoms. Anxiety slowly builds up in a person, and it usually is related to deep worries where they are thinking about something, not able to process their emotions, and land up in this kind of troubles. And usually it gives you time, you understand, it starts with palpitation, you have symptoms like a lot of sweating, you go to washroom, you have slurry speech and other things, but you know that this is happening to me. So it is very slow. When we come to panic disorder, it's like a bomb blast. Usually it doesn't give you time, and usually panic disorder patients come to us saying that they feel that they're going to die, it's a heart attack. So they're sitting somewhere normally sipping a coffee, and suddenly they will have a blast of panic where they don't know what is the reason, where they don't know what happened. They will just feel restless, breathless. They will have tightness in chest. So people usually think that they are having a heart attack, but when they come to the clinic, we assess them, we realize that this is a panic disorder. So the very distinguished feature between anxiety and panic attack is the speed of how it happens. So usually panic is very very fast, very unannounced, while anxiety is very slow and it builds up with time.
Right. So I think that it's important to differentiate between the two.
Yes.
And can both be well controlled?
Yes, both of them can be well controlled with lifestyle modifications, medication management if needed. If anxiety is for longer time, for 6 8 months, we definitely need some kind of SSRIs. And with panic, we need a lot of management of how your symptoms are happening. Are you taking caffeine or not? What are your timings for sleeping? Everything plays a very big role.
Moving on to stress and the weight of stress, the role of cortisol, it's a very upcoming discussion that we should have. And stress, again, like anxiety, is an overused word. And it's been really put in as a cause for so many actual health problems as well.
Yeah, so when it comes to stress, stress is again a pile up of a lot of things. You are on a overdrive with everything in your life. You want to maintain work life balance, you are trying to maintain a family, you are trying to maintain your socials, you are trying to understand that I want to get on a threshold, you're trying to maintain your physical health. Everything when amalgamates gives you a lot of stress.
As professionals, I think some people also notice stress on a regular basis. And I've heard the word burnout coming up very frequently these days with a lot of professionals. I see it in doctors also, I see it in other content creators also who are facing burnout early in their age at 30s and 40s. So, what exactly is the difference between stress and burnout?
I think burnout is a mini version of stress. We can say that before we reach to chronic stress disorders, what happens to us is burnout. Our body starts telling us that we are not able to fulfill all the areas of life. And there are days where nothing feels okay. You don't want to go anywhere. You don't feel like doing anything. You feel that, life has lost its pink as well. So that is the exact sign where your body comes and tells you that, see, I'm feeling tired, I'm feeling burnt out, and I need rest. So usually when you rest, you take a weekend off, you take 2 days off, this goes off. And when you address the problems or address the triggers that what is happening to you, usually this tends to settle down. If we don't settle this down, we end up in chronic stress.
When we talk of stress, I think some people think it's purely mental. कि दिमाग में stress है, बाकी कुछ नहीं है. But I understand there's a physical component to it also. So, what do you feel that how would stress contribute to problems with physical health?
So usually we see clients who have chronic stress disorder and haven't been identified, usually especially in women, where I've seen that this kind of stress has led them into metabolic disorders, especially thyroid disorders, where some people are not able to speak, not express, and that also causes a lot of stress. Not able to express anger, landing it chronic stress gives a lot of autoimmune conditions as well. So I have seen this relationship in women, especially where that they undergo a lot of stress throughout their time, and during their perimenopausal age or postmenopausal age land up in autoimmune disorders. Nowadays, young girls with PCOS and thyroid consistently have been under stress. If you see their past, they have been gone through an emotional or a physical turmoil which caused a lot of stress, and then they ended up here. So we can definitely connect the dots with physical and mental relationships.
And I guess that the importance of stress in artery blockages is also becoming very, very
Absolutely.
popular.
Like I have seen so many people with raised triglycerides and complete bad dyslipidemia. And when being asked, they are eating well, they're doing all the exercises, but have constant stress. And this leads them to a risk of coronary artery disease at a larger time.
When you say reducing stress, but there's so many professionals or even people who have to be working for long hours, they're not able to control their working hours, or probably have to be traveling more often, more frequently, have to be up late at night, waking up. They may have altered, sleep patterns due to their job or profession, whatever. So, how do these factors work upon our cortisol level and circadian rhythm?
So, this is the most important thing which affects your health. When we talk about cortisol in our body, we have two cycles. One is the morning cycle and one is night cycle. Usually, when we get up, that is the result because our cortisol goes high, and that is how our brain is indicated that subah ho gayi hai, you have to wake up. Along with cortisol, our serotonin goes up, and that is how we start our day. When we are staying up at night because of work, because of whatever reason, the brain doesn't understand that it is night. And that is why our cortisol is going to be up and our melatonin is not going to be produced. And this is why our brain feels that it is a day, and that is how working longer hour of day is going to affect you adversely. You will have weight gain, you will end up into metabolic disorders because the brain doesn't process. They feel that it is a day, and in order to make our brain understand that it is night, and in order to have melatonin production, we have to go off screens after 8 to 9 p.m. That is how when the dark light goes in our retina, we feel that yes, it's night, and the melatonin secretion starts. And this is the only reason people are on and off taking melatonin supplements, because they are not able to sleep. But the reason is blue light and inconsistent sleep patterns.
So, for all these busy or overthinking people, what practical steps would you recommend to reset their cortisol levels
So, first of all, stop caffeine intake after 2 p.m.
after 2 p.m.?
Yes, after 2 p.m., if you drink coffee, you are going to be up late night. Second is when you go to sleep, keep your room cooler at 18 degrees Celsius. This helps you in sleeping early. If the room is warm, your cortisol is not going to be balanced. Your brain is going to feel कुछ चल रहा है अभी भी मुझे comfort नहीं आ रहा है. So this is one of the techniques which we use in our clients, that room को ठंडा रखो. Third is your screen should be off at 8 p.m. You do not need to use blue light after 8 p.m. If at all you are working, wear blue light glasses and make sure that you are not exposed to the light directly. And the fourth is maintain a good sleep hygiene. Maintain a time. If you're sleeping at 10:30 p.m. every single day, make sure you do that. There are people who think that I will sleep at 12 and then the next day I'll wake up late and compensate. But the brain doesn't understand. Your timing has to be perfect to sleep, and that will set your circadian rhythm. Usually, when you sleep on time, you will not even need an alarm to wake up. You will just get up on time.
I think that's so important that there's an alarm right here in the brain. So the tips you've said would really help in reducing stress. And I guess sleep is that time when the stresses can be reduced. The body gets time to cure itself.
Correct.
The importance of sleep is very high, not just for mental health, but for physical health as well. So, what advantage or how does really proper sleep help physical health?
I think sleep is the only thing in psychiatry and psychology which we recommend really to get away from a lot of mental health crisis. Sleep gives you a lot of recovery, be it physical or mental. And here I would like to talk about rapid eye movement sleep, which is very less in women. Usually, I wear a sleep tracker and track my REM. Even if I'm sleeping very peacefully, it doesn't go more than 52 minutes. So, in men, it is more. And in men, it is usually seen that a single day of cycle cures them. Why? Because their REM is perfect. So, for women, REM sleep is very important. That is where you get muscle recovery as well as mental health recovery. And because your brain is a muscle, it definitely recovers during your REM sleep.
And for sleep, there are so many people, including me, we wear fitness watches, sleep trackers. So,
Correct.
how good or effective are they or useful are they?
I think they are effective. I wouldn't disagree to this, but when it comes to women, we have different phases. We have follicular, luteal. So usually what I do personally is that I check my luteal phase and my menstrual cycles. If I am doing well in my luteal phase, I know that I have been sleeping well. The hormonal disruptions which happens in women due to poor sleep are very evident and huge. So in women we can see that we will see that there are a lot of weight gain, the estrogen is not doing well, or their metabolic issues are not doing well. And that is where the first question is that, are you sleeping well? While when we see in men, you guys have 24 hours of cycle, and it really is a miracle that after 24 hours, you are just in a reset. So you guys can use these trackers more. This is more beneficial for you guys, in my opinion.
And apart from physical health, how does poor sleep or inadequate sleep affect mental problems like anxiety or depression?
Let's talk about mood disorders here. A very, very striking example which we saw in a patient was in a bipolar disorder, where in a manic phase they were not able to sleep for a longer period of time. The sleep was around like 4.5 hours, and the manicity in these patients went very high. They were very sick, and we had to prescribe a lot of medications for the sleep. So this is what happened, that the serotonin and dopamine are so high that it doesn't let the patient sleep, and it adversely affects the disorder. Similarly, in depression, people can sleep too much or too less. So both the things are affecting adversely in any disorder. Even if when you sleep too much, you will not be able to process things. When you're sleeping less, it's evident we don't process things very well.
So, from sleep, moving on to awareness about mental health. How does someone really know that they need to visit a therapist?
I think there are very striking signs which a lot of people tend to avoid, thinking कि चलता है, हो रहा है. But those are the actual signs your body is telling you that you need to have help. Loss of weight or gain of weight, which is more than 5 to 6 kgs in less than 2 weeks, is a very striking sign that you're going through something. Oversleeping or less sleeping, the family members will come and tell you that ये बहुत ज़्यादा सो रहा है या ये कम सो रहा है. So that is one of the striking signs. Loss of appetite or overeating. So we stand on a spectrum when it comes to mental disorder. Either it is very less, either it is very more. But the family members will be able to see that there is a change in a person. Loss of interest in normal activities which you loved to do before. Everything, every set of symptoms which happen in span of 2 weeks is not going, is getting worse, is the correct sign that you need to go to a mental health expert.
So, when you say that families can recognize this, but I guess it's important for families also to realize about talking correctly about mental health without attaching the stigma to it. So, what tips would you give for such families?
I think, in my opinion, when it comes to parents, especially mothers who usually take care of the child, they have to ask a question that how are you feeling emotionally, rather than saying that why are you not feeling okay. Because when you give them space to open up, that is the only chance they'll be able to talk. So no defense questions has to be thrown at them that why are you not feeling well. This is going to settle down. अरे सो जा सही हो जाएगा, or this is just a phase, it will pass. So we as families, we as families and we as supportive members have to understand that they need space to open up. Once you give them space to open up, they will come to you, and then you have to push them for getting help. Once you tell them that this is going to pass away, it just creates a barrier between you and them. So you have to be more open towards the agenda of asking questions.
So important as family members that you can be very supportive of someone who's undergoing a difficult time. When it comes to smaller cities, so what mindset difference or shift would you recommend for people especially when it comes to stress and building resilience?
I think when it comes to stress, there has to be an acceptance that anyone and everyone can have stress. The stressors can be very different, and it's okay to have stress. Nobody is going to be spared in this lifestyle who will not have stress. And when it comes to resilience, keeping shut, not asking for help is not building resilience. Resilience is where we go through it, and when we adapt the changes and we stand by it. सो कहते हैं ना कि अपने पैर पे खड़े रहना with everything going on is resilience rather than keeping shut and thinking नहीं अब मैं नहीं बोल सकती, it is going to pass. Usually this is the mindset that this is called resilience, but it is vice versa, it's the other way around.
So, do you feel that the stresses are more in metro cities as compared to smaller cities?
Yes, definitely. I think it's more in metro cities because of the lifestyle. I think the lifestyle which we live here is far more better than the lifestyle people have in tier 1. We still respect our food culture, we respect our sleep hygiene, and work life balance is still maintained in Vadodara at least. But when it comes to bigger cities, it's completely whack off. So I feel that it's worse, far more worse there in tier 1.
So, what methods can people resort to when they want to really take care of their own mental health? They want people these days, they want to do things on their own. If they have a problem, they want to find solutions on their own. So, what would you recommend to people who are wanting to find a solution for their problems?
I think I would love to emphasize on movement. 45 minutes of walk, gym, training, whatever you want to do, just do that because it is going to release good dopamine in your brain and you are going to feel better after movement. So, that is number one thing everyone should follow. Second is journaling. If you are not able to talk to anybody about your symptoms or your complaints, start writing it in a journal. This is how you sort it out, and this is how you'll realize that is it really serious and do you really need help. Third is early visits to mental health expert, early preventive screenings. Just go and talk to them about your feelings and try to understand if you really need help or not.
One another common problem that many of us face these days is comparisons and overthinking. So, how do you feel that one can really overcome this?
I think whenever one goes through this, they have to ask them one single question. Are they suffering from low self esteem? A lot of problems root from there. And usually people don't realize that they have a lower self esteem before this starts. So we have to understand that we are at the right position at the right time, and we can always achieve everything when we work hard. यूजुअली क्या होता है हम सिर्फ देखते हैं एंड वी नेवर रियलाइज व्हाट दे हैव गॉन थ्रू टू रीच देयर. So when we go through the process, we will definitely achieve our results. But to overthink it is not going to lead you anywhere. So it's a very practical advice. Thoughts come and go. You cannot stop thinking, but you can always identify where you are crossing the limits of thoughts. कि मैं एक ही चीज पे obsess हो रहा हूँ या हो रही हूँ, and that is when you realize you need to put in the work rather than the thoughts there. So when you talk about this to yourself, you're definitely going to stop overthinking about it.
Correct. So, I feel that, instead of comparing, there's always some inspiration that you can look forward to. That's a positive way of comparing ourselves to someone.
Yeah.
So, maybe getting inspired by people and trying to do what people are doing instead of thinking why they got something or why are they doing this and I'm
Oh,
unable to do it.
yeah. Maybe use that energy to understand what kind of path they chose, what hard work they have put in, and realize that how much time did it take rather than overthinking that why I cannot do this or why am I not there yet.
And on a concluding remark, what advice would you give to our viewers about living a healthy, happy life?
So, one golden rule I would tell you guys to follow to live a very happy and healthy life is that don't ignore the signs and respect your body, respect your mind. They are always giving you subtle signs when you are going through something bad. So, don't delay these triggers, don't delay stress, don't delay episodes which you have in a form of a micro problems. Don't do that. Always face your problems and always remember you always have help for your mental health.
So, thank you so much, Sachi, for being here and sharing your opinions and bringing out discussion on topics which are not so commonly talked about. And I'm sure our viewers will benefit a lot from this. And if there are any comments, please do write them. We will respond to the comments, and Sachi will be helpful and she will guide you. She also does online consultations, and we'll put the link of her clinic in the description too. So, thank you so
Thank you
much.
so much, sir.